Okay? So now we have this little baby who's just said, "Oh, thank you, Mom, for that meal." And my little tummy starts to feel uncomfortable, and now my little tummy starts to get really, really uncomfortable. And what you'll see in these little babies, in all of the exams that I've done, in a child who has colic and a child who has projectile vomiting, you'll see their little tummies, instead of being that fat little tummy that pokes out in the front, okay, you'll see them become wide at the sides. They look like little lizard bellies, right? And they're tight. When you touch them, they'll cry out because it's so painful. Because their little bodies are actually producing more and more of a reaction based off of the reaction that's coming here. Now they'll start to projectile vomit in an attempt to get this out, and they'll have the little diaper blowouts. And then when you look at their little bottoms when they turn around, what do you see?
Rash and thrush.
En fuego. Yep.
Yeah.
Rash and thrush.
Yeah.
Right? It's on fire. But you won't hear that.
No, because my doctor kept saying it doesn't matter what you eat, it doesn't matter what you eat.
Okay. Then it doesn't matter that he never learned physiology.
Yeah.
Because basic physiology is passive immunity to the child. And when that antibody starts to attack the baby's linings, it's going to try to emit that as rapidly as it can. Okay? And you're going to see a baby that's in failure to thrive.
Yep.
So what are we going to do? Again, we've got a medication for it, right? We're going to give them protonics. Give them an acid blocker. We're going to force them to keep it in. And now the child is nuts. They cannot tolerate anything. Okay? And the more intolerant and uncomfortable they become, the more unmanageable they become. And then, what's my relationship, nurturing mom, frontal lobe, to this child?
Very frustrated.
Oh, get me out of here! Right? And the child's saying, "Get me out of here." So then mom says, "Well, I'm done nursing you. By now, 3 months have passed. I'm not going to keep dealing with this spit up. So I'm going to give you soy formula." Which has been outlawed in Europe. Why? Because of the number of allergies that it creates in infants, in adults. Okay? And consequently now, what's happened to this little person's GI system and antioxidant system and glutathione producing system? It's completely en fuego, right? It's on fire. And consequently, this little person's brain is on fire. Okay? And what does a kid with a brain on fire look like?
ADD.